What's up, team? Welcome back to Dentistry Invest podcast. I have sat in front of me for familiar face from the podcast and also from social media, Dr. Sunny of the Dre Composite Restorative Technique. Dr. Sunny, how are you today?
Yep, Superman. Thanks for having me. How are you?
Always a pleasure, my friend. I'm flipping 11 out of 10. Thank you for asking. What have you been up to today? What's keeping you busy?
Today, delivered a couple of lunch and learns. Um, yeah, that took up my lunchtime so far. So talking to happy dentists like you.
That's where you shine, though, right? You like the stage.
Yeah, but only when I've got something to say, right?
Which is all of the time. No, I'm kidding.
Yeah.
Anyway, mate, so we're here today to talk about restorative dentistry and how we can make it as profitable as possible. And here's the thing I want everybody to remember. I think people get really, really, really hung up on asking from a higher level of remuneration from the patient. Actually, that is the thing that facilitates your ability to deliver more value, which is what we're here to talk about today. Naturally, the more time we give to someone, then the better a job we can do. Of course, that's going to be reflected in the remuneration, at least to a degree, because time is money, as we all know, or at least that's the belief system that we're all indoctrinated with. Because I agree with that, but only to a point, because value is money as well. In fact, value is money is a better statement. So when we give someone more time, we give them more value, and then therefore remuneration is to a higher standard. And that's going to be one of the key things that we're going to touch upon in this podcast. So let's bring it back to reality. Let's bring it back to this podcast right here, right now, today. Dr. Sunny, given your voyage throughout restorative dentistry and getting to where you are, what are the coolest things that you have learned along the way in terms of profitability? Or if you could go out and wave your wand like this and teach the dentists of the world something about restorative dentistry, which would enable them to become more profitable, what would it be?
I'm going to touch on something you just sort of teed up for me.
Alluded to, not so
Yeah,
subtle.
yeah, that price is what you pay, but value is what you get. Right. So that's like a big one. That was a bit of a shift for me in my understanding, right? So I'll give an example, right? I started doing, these larger composite restorations instead of like post-core crown, right? And so I learned a technique for direct composite crowns from Subir Banerjee, like Lundek, King's College. And so he did it with sectionals and all the rest of it. But of course, obviously, everybody knows I'm a great curve boy. So obviously, I developed a technique around of it. It was a two-step, and it just made a bunch of sense to me. And then I told one of my good friends how much I was going to charge for it, right? So at the time, I was going to charge 495 for this. Well, this is what I was charging. And he was like, cool. And I said, look, I'm thinking about putting my price up, right? Because it's taking me 90 minutes. My hourly, let's say I'm, for example, working towards a 500 hourly, then it should be 750 for 90 minutes. So I said, I'm going to charge 795. And my friend said to me, you can't do that. It's a composite, right? And then it took me back, right? Because then, of course, this is a dentist who's not seeing the value that the patient's going to get, right? So what the patient's seeing and what the patient's hearing is that we could do this option, and it has its risks, as do all things. The risk with that involves the elective root canal plus the post plus the core plus the crown on top, and then multiple visits and all the rest of it. Whereas what we were proposing would maybe have the risk of an endo, maybe, yeah, but I'm pretty careful, use caries dye and all the rest of it, so you're staying well away from the pulp. And the benefit to the patient is in a 90-minute appointment, they get this same day tooth, and it's reconstructed and it's got a really, really good seal and all the rest of it, all the other prerequisites for a good restoration. And yeah, a lot of my attention and focus has gone into that. So that's quite an interesting area that I'm really exploring with and have been since probably about 2018 when I sat Sabir's course.
You know what? And there's an analogy that I use on this in dentistry, right? And this is what I say all the time, right? If I go to two people and they're both offering to build me a house, right? One person, the price tag is 10,000, the other person is 200,000, right? Now, if they don't tell me anything else about that house and how it's going to look, and I'm going purely off price, which is what lots of patients do in the dentist patient interaction, because the dentist generally don't give them any more information, right? Then I'm going to go, this is a house, the 10,000 thing is a house, 200,000 thing is also a house, right? So I'm going to go 10,000 it is, my man. Let's shake hands on it, right? Come back 6 weeks later, right? Look at my plot of land that I've purchased, right? See this big old hole like this, right? And when I go and peer over the edge of the hole, there's a little mud hut right there, right? Okay. Guy who built the house is like, yeah, you wanted a house, £10,000, you get what you pay for, right? Go live in the house. First rainfall comes, mud house washes away. And I'm like, what the hell? I paid £10,000 for this. I can't even sleep in it. I didn't get what I wanted, right? I wound up having to go back to the other person anyway and giving them £200,000, right? But he's like, oh, well, now it's a little harder because guess what? Guess what? That big hole that the last guy dug has messed up all the bedrock under your house. Now we're going to have to go back in and fix the bedrock, but here's the kicker. It's never going to be quite as good as what it once was, right? So I'm going to have to pay the guy anyway for the second time, more hassle, all of that, right? And it's never going to be as good as what it was in the first place, right? Can you see how the £200,000 guy, it was his duty to tell me why he was going to do a better job than the other person, because now I'm miffed. Yeah?
Totally.
Let's bring that across dentistry. Do I even have to explain the analogy there? Is that obvious enough? Or do we have to go one step deeper and make that super obvious? Yeah? Or we're good? Yeah,
No,
I
I
think
thought
you
that
can
was
see. Well, what I'm
clear.
talking about, I'm talking about the first restoration that's much cheaper versus the second one, right? Yeah, the second one would have actually lasted a significant amount of time, right? And it would mean that I have more tooth structure to play with whenever it needs to be replaced, right? And that's
Sure.
fine, but it actually would have done its job. That's the main thing. But here's the thing: in our head as dentists, we're trying to sell a £10,000 house all the time because we feel like we're doing the best service that we possibly can to the patient when we're just flipping not. We're making price the only factor when it isn't.
Sure. Makes a bunch of sense to me too. And then the other thing, interestingly, off the back of that too, is what I try not to have is, because when you're associating, you're not really setting the prices, right? You're not setting the fee. And so humans, we have biases, right? Incentives matter massively, subconsciously or consciously, right? Some of us are just, real numbers people. Other people are subconscious. So if you've got a treatment modality that costs 750, let's say for a crown, and then you've got for a large composite, it's 280. Right? Naturally, you're going to be drawn towards the higher end of the spectrum when you see this broken tooth. Now you're like, I think crowns are better. I'm like, yeah, of course, but we have biases, right? That can affect our decision making. So how I work is I try not to make the price the distinguishing factor. So it costs the same. Both take the same amount of time. It costs the same. It's what's going to be best for that situation, for that patient, for that tooth. And there are other factors outside of just clinical papers, such as patient factors. Perhaps a patient doesn't want to come back. Perhaps they can't sit there for too long. Perhaps there's other things. You could have patients with Parkinson's, dementia. They cannot sit for long periods of time. So I just think there are other factors as well that go into what's going to be best for the patient, as opposed to just going through from a textbook standard.
I've got a really useful method for figuring out whether or not you're making price the determinant factor on which treatment you offer, right? So this is to really figure out what's going on inside your own head, right? You can use this process, right? So here's the thing: you look at the patient while you're looking around their mouth, while you're doing your clinical check, your exam, right? You see a tooth, there's an issue with the tooth, yeah? And it's got decay, it's got a fractured cusp, whatever, right? Look at the tooth, then in your own head, think to yourself, if that were my tooth in my head, how would I prefer for it to be treated? What is the best? Let's put cost, not even consider it as a factor. Let's put it out the window. Let's just not think about it, right? If I wanted the best, or what I believe to be the best for this particular tooth, what would it be? Yeah. Now, second thing you do, look at the patient and kind of see the bigger picture at this point and think to yourself, okay, now if I know what's the best for me, is there any reason why that would change for the patient in terms of giving them the best clinical outcome? Right? Yeah. Now, here's the thing: that may change, that may make you change your decision on what's best for that tooth clinically, but 99% of the time it won't. Whichever one you go with, right? If you offer anything different to the patient than what you just imagined in your head, then you probably made it a price thing, okay? Because you might have thought to yourself, well, the indirect restoration is the best thing. Then how many dentists will sell the filling and not the indirect because they're scared of talking about the investment level, because they're scared of talking about the price, right? And if you do that consistently, then what you're doing is you're making price the main factor in the treatment that you offer, which, going back to our analogy just a minute ago, we know is not the biggest factor, because we know that it can lead to outcomes which are way less favorable. And also it can mean that when we do eventually choose that definitive treatment, or that more definitive treatment option, the indirect, that because we've removed more tooth than we like, now we get a compromised outcome, whereas we would have just been better to do it in the first place and accepted the fact that the investment might be a little higher.
Like your hole with a little hut, right?
Like the hole with a little hut, right?
Ah, see, I'm a good student.
Metaphors work, right? Because people can
They
just
do.
visualize this stuff in their head.
I've got a great one too, like going to your point, right? When you go to a restaurant and you have a meal and you finish your meal and the waiter comes over
Mm-hmm.
and says, would you like a coffee? Yeah. You can decide yes or no, but it's good service, right? Right? You're happy that the guy has come and offered you, would you like coffee now? Would you like dessert? It's the same deal. You're just giving good service to the patient, right? So I'm not really scared of the no or the rejection or whatever. You know, some people are going to want what you have, and some people aren't going to want what you have. You know,
Because
it's not about you.
when the waiter does that, you say no, thank you, right?
There you go. There you go. There
Awesome,
you go.
man. Cool,
Yeah,
cool, cool,
yeah.
cool, cool. Okay, cool. So maybe we talked about the mindset stuff a little bit. Let's talk more about the technicals. What are the things you realized along your journey in restorative dentistry that you thought, if I do it like this, actually I'm serving someone better, therefore I'm delivering more value, therefore that is naturally reflected in the remuneration.
But I mean, I've got an interesting thesis, right? One that we share with our delegates all the time. Right? I think actually, when you think about when we're in a practice, what we're trying to do is a patient comes through the door and we're like, okay, he's interested in whitening. So yeah, I'm going to sell him the whitening, right? He's going to get the whitening. I've got some collection for towards today's takings, yeah. And then they say, I want to replace this one tooth. You're like, okay, cool, we'll do that. You're always just thinking, right, what can I get from this person? Right? And maybe not everybody, but for me, that was in the mind. In the mind when you've got a mortgage, you've got two young children, you do have this little bit of you have this little thing in your mind, right, that you need to collect beyond a certain point to break even or whatever it is. And interestingly, now my thesis is this: that actually we shouldn't actually want to sell everything to the patient, and sell is an ugly word, right? But just guide the patient to the right decision that's best for them. But yeah, the example with whitening, you can sell the whitening for £250, £300, or whatever, and you can spend appointment time doing that. But your appointment time is really valuable. And it's probably the most valuable chair use in the whole surgery is when you're in it, right, as a dentist. Yeah. So I actually think the whitening should be reserved for like hygienists, therapists. They could take care of that, and then they can get some upside from that, right? And they can generate business that way for the practice. Whereas what we should be focusing on is the stuff that we see every day. So Mrs. Jones comes in and she has caries in a 7654. And then typically what we do is we have the appointment, we get them in, we have the rapport, you have the numbing, you have the tooth surface preparation, you have the restoration, you have the finishing up, and then you say goodbye. And you've done that filling, right? And then the next patient comes and you do the next filling, but you've still got that pre and the post. So you've got the hello, set up, numb, prepare the tooth, and so on and so forth, right? So you've got this cycle happening over and over. But how more efficient is it when you say, Mrs. Jones, you've got these four teeth that are completely trashed, right? They're really bad. They need some attention. I've got 90 minutes free next week. I can actually get you in. And what we'll do is we'll make this super comfortable for you. It's minimum injections. I know you don't like those. Minimum, it's going to be super numb. You're not going to feel anything. And I can get all of that done. It's really easy for me in the manner that I work to get that all done in one day. And that's it. You don't have to worry about it anymore. And I think our direction should be, pointed at helping the patient do that comprehensive care, get the stuff done. Because listen, if you don't help them make a decision, they're doing nothing, right? People go away and don't come back. How often is that? How typical is that? And they go, I told the patient to come back. Yeah, but this is just humans, right? If you don't help them make a definitive decision, they won't make a decision, right? So if you don't offer them the coffee, they're not going to take it. So then it's up to her to say, all right, I'll have all four done or not. But by doing that, you massively improve your efficiency. And quadrants, for me, are the low-hanging fruit of dentistry. It's the stuff we see all day long. We don't need to market for it. You just need to get really clear and effective at saying, look, it's really important we do this, and not say, if it's not something to monitor, then don't monitor it. Say to them, in my judgment, we need to do this. And again, once more, it's the coffee. If she wants it or not.
Beautiful. Lovely, lovely. And that's more from the technical side of things, of course, just as we said. Let's build on that a little more because we're on a roll now. We're on a roll now. What other stuff do you feel that dentists could do better to deliver more value on the technical side of things? More like the day-to-day in the mouth stuff.
Yeah, I mean, I'm gonna can I cut into that a little bit more?
Yeah,
Go into
yeah,
the
yeah,
quadrant bit, yeah.
yeah, yeah.
So all right, so just digging into the quadrant side a little bit more, right? Again, the low-hanging fruit, the stuff we don't need to market for, the stuff that we see all the time. And again, if you just, if a private composite is being done, let's just say 200 quid, and you're doing four of them, and you can get it done in 90 minutes, right? We teach how to do that. For some people can do it in 60, some people can do it in 90. But you work out the hourly on that, that is freaking impressive. That is really, really impressive, right? So one of our commercial angles is that not just through one of our programs, right? The Direct Restorative Excellence program. There's other ones that build upon that. But we help these dentists grow 2 to 4K, right? And so that is
Two to
possible
four K
just
what? Sorry, that
a
word just
day, a
a
day.
day, a
Yeah,
day.
sorry, I have to clarify that, right? And we'll touch on that later as well, right? Good case study on that. But yeah, like it's not beyond the realm of possibility, right? It really, really isn't. And so just by doing good quadrant dentistry, comprehensive, spending your time with the patient to, like I said, guide into the right decision, that this makes a bunch of sense for you. And this is why we should do it, as opposed to spending appointment time selling something like whitening, which I just don't think has, I want to first of all treat the health and the disease, right? And if they've got both, they've got caries and they've got whitening needs or they want, I'm still probably going to say, look, no problem, we can get that done, but this is much more important. And again, it's win-win, right? They get what they need, a healthy mouth, and we get what we need, good production.
Boom. Was there more to that? I was listening. I was fully invested in listening to that.
Yeah, so I'm just saying on the hourlies, I mean, it just makes a bunch of sense, right? It just makes a bunch of sense to do that comprehensive stuff. I'd also add to that, then I've got the point, right? Is you should play to your strengths, right? So I play to my strengths. All I do is direct resto, right? Direct resto. If I need some indirects for my patients, I refer them to colleagues of mine who are much better at indirect than me, and they can get it done at the same hourly. But if you're doing, let's say, for example, an endo comes to the door, it's pretty complicated, and you're charging 350 for this endo, and now it's going to take you 2 hours. Just mathematically, it's not going to make sense, right? You're better off to refer that and stay in your lane and do what you do best, right? So we do that with delegates a lot. Like, we coach them through that a lot, like saying, what are your strengths? Because sometimes we want to plug every single hole that we have. We have holes in perio, we have holes in endo. You want to plug every single hole. Truth is, maybe you probably shouldn't do that. What's your natural proclivity? What do you really like? What lights you up? So for me, conversation, I just find it so interesting. Everything about it I like to do, right? So therefore, is it that I liked it first, or was it that I was competent first? I think, because I got competent, I liked it, and therefore it became a cycle. And alas, this is where I am, right? Just doing restorative referrals mainly.
Well, it comes back to Pareto's principle, right? The 80-20 thing, right? 20% of your actions get you 80% of your results. And what you do in dentistry is exactly the same, right? And there'll be of all the specialities you can have, it's only natural you're going to be better at one versus the rest, right? It's just a math thing. If somebody's doing something all day long, someone's doing endo all day long, they're going to be better than the GDP at endo, right? Yeah, it's just the thing.
Totally,
Yeah.
totally.
So
Yeah, yeah.
here's yeah.
To that point as well, I mean, when I just picture my NHS days, and then there I am doing my NHS stuff, and then patient come in and would want two private composites. And I look at them and I go, oh, in your head, you're like, it should be this amount. And then you always say lower than what you mentioned. Actually, Latta has this all the time, right? He says, we always have this number in our head, but we always quote lower. Now I force myself to do the opposite, right? Just say more than the mind thinks, right? But anyway, usually basing it off of time keeps it super easy. But I remember this particular case, patient comes in, two really badly broken down teeth, says, I want private composites. And it was 100 each. And I was like, okay, cool. And then I was doing it and I was struggling. Right, I was really struggling to do it. Composites is pretty technical, right? And my point is, you need to practice it. So when I'm only doing a few composites a week, or 10 a week, or 5 a week, or whatever you're doing, it's not enough, because most of the time I'm doing amalgams, or I'm not working in that manner, right? I'm doing amalgams, and then this is requiring, isolation and real attention to detail, right? Where amalgam doesn't, it's like wartime dentistry, you get away with it. And then so you've gone from these two contrasts of like this 20, 30 patients a day mode to then, oh no, I'm going to slow down now. I'm going to book an hour to do these £200 composites. And I just didn't do them very well. At the time, I thought they were great. Yeah. But anyone can make them look good on the day, right? You look at all the turkey teeth stuff. It all looks good on the day. It looks amazing. But we know it's a car crash under there, right? So my point is, your habits are formed by what you do. Yeah. So if you're doing that procedure all the time, then you're going to be proficient at it. It's very similar, when it comes to facial aesthetics, where dentists do facial aesthetics. And take it from me, I dabbled with it since 2016, only to like last year say, no, I'm not doing it anymore. Right? I got a whole thesis as to why I think dentists should do it, but I'm not doing it anymore. Because when you're doing it sporadically, you're average. You're average. And so I've got a clinical assistant, right? Nurse, does facial aesthetics. Actually, I taught facial aesthetics once upon a time, the dark side. And he came to it and he just stuck at it, and I didn't. Now he's injecting 3 times a week. And I tell you what, his work it destroyed mine. Easy, easy, because he's living it, he's breathing it. So you want to be something, right? You got to do it, is my point here.
Lovely, lovely. And yeah, it's the whole Pareto thing, right? Yeah. And here's the thing, right? The reason why that gets you remunerated to a higher standard is, number one, because you're better at it, therefore the value is higher, therefore the remuneration is higher. Number two, less likelihood you might have to refund things that don't work out. And three, here's the best bit, it's fun for you. It literally gives you energy, right? There's two things in life. There's things that take energy and there's things that give you energy, right? You find the thing that you're good at and it also is valuable and useful to other people and it gives you energy, you're in a flipping sweet zone, right? Because you can literally do that thing, get all those positive outcomes and come away and feel energized, right?
Mm.
Most people go to work and spend energy, right? You go home at the end. Here's a really easy way, right, to litmus test that, or to pretty much just take your finger, lick it and stick it in the air and figure out if that's going well for you or not. If you come home at the end of the day and you feel drained, chances are you're spending energy to be there. Then what you have to do is recover, right? it now takes you energy to replenish your reservoirs of energy, right? Where
Yes,
imagine if you could just do the thing that made you energized so you could do more of the thing, right? And
totally.
that's possible. It's a self-awareness thing. You have to taste that side of life to be able to understand that it's true. And here's the thing, let's home down into that a little deeper, right? Maybe there's certain days you're going to work, you're coming home like, yeah, oh my goodness, that was amazing. And some days you're coming home from work and you're like, oh my goodness, right? Yeah. Figure out what the difference between those 2 days is. Pick the day that gives you energy and double down on whatever things you did in that day that gave you energy, right? And here's the thing, you're getting hotter and hotter to what that eventual cool life, ultimate life for you looks like. One more thing I'm going to chuck on top of that as well. It starts with measuring what you do, master what you measure. I think every dentist should take some time to log on an Excel sheet at the end of the day what they're doing and what they're grossing for each one of those treatments, right? And you can literally look and how you feel at the end of the day. You can literally go back, figure out what treatments are making you feel happy, figuring out where the 20% of things that you do, where they are, how they look, what that day looks like, figuring out what the 20% of things that you're doing that are giving you the 80% of results, right? And then you just concentrate on those. And it's true for any business. It's true for any dentist. It's really cool.
Mega, mega. I mean, that's actually an exercise that we do with our delegates, right? So the ones that take it to the next level really want to focus on production, not just the clinical side. That is one of the exercises. Like you bring what you've collected, what position, what procedure you was doing, and a lot can be gleaned from that. Second one I've been doing for a very long time is keeping a spreadsheet of complications and failures, right? So what
Oh, interesting.
Yeah. So I've shared this one before, but I mean, quite literally, you just put what, have a few columns. What happened? How did it present? Yeah. How did you notice? When did you notice? Yeah. So usually the patient will tell you, or you noticed when they came back. Was it 1 week later, 2 weeks later? All that. What category was it? Was it resto, endo, surgical? And your comments and how you rectified it. Something along those lines, right? It doesn't have to be verbatim like mine. But that is, the information you can glean from that is really quite telling, right? Because then from that, I found out I was pretty good at composite, right? Even before the sort of greater curve phase of my life, I was relatively okay, yeah, compared to the other things. So I'm not saying I was good at the time, but I was certainly better at composite than I was at, endo or extractions or something like that, right? Those were certainly things where actually I had patients coming back needing extra attention, right? And that attention is not paid. So another exercise you could do, if you take a dentist to say, all right, you're working 40 hours times 4 weeks, what kind of hourly rate are you working towards? Work out that approximate figure, and you'll find what you actually collect versus what your projection would be, as is there's a discrepancy always. So where does that discrepancy or inefficiency come from? Yeah. I think it comes from refunds and redos, yeah, redos in particular, right? Because what we did, and this was me. All of these things I'm talking about were me, and now I see it in the people that we work with, right? But a patient comes in, something's not looking right. We're perfectionists, yeah, and I think we're pretty conscientious people. We're optimizers, we're analytical, we're smart, but we care as well. Most, yeah, care to a degree. So if they see something, they go, I'm just going to quickly go in there and sort that out. Right? How many times we did that? I did that so much, right? And then when you go revisit it, you're cutting into the chair time now. So the chair time's costing on the one hand, and on the other hand, you could have been grossing. So you've lost twice on that front. So now you're redoing this stuff, cool. But we redo a lot of things, little things here, little thing there, little thing here, little thing there. Dry socket comes in. I'm not saying all of this is avoidable. Some of it's unavoidable. It's just the way the cookie crumbles. But there's a point where it's like probable, and then there's parts where it's just like unlikely, and probably you're the commonality. So if you're getting more dry sockets than everyone else in the practice, as an example, it's probably not the instruments are dirty. It's probably something in your technique, right? So you can just drill down into that sort of stuff, right? So yeah, I think self-awareness is massive. And you said about some days are great and some days are not. I think that also lends itself to consistency in your life and being self-aware. So it may not be the day. You could have had 2 days that were very similar. One day you liked, one day you hated. But one night you got very little sleep because you was on YouTube all night. And the other day you got good rest. And that day was amazing. So there's something to be gleaned. It may not be your horrible principal or your horrible PM and everybody you want to blame at the time. It might be just you was a bit slack with your discipline and not getting to bed on time. Talking to me here, by the way, the younger me.
Good stuff, mate. Good stuff, good stuff, good stuff. Let's drill down on the technical stuff in terms of composites, right? So if you could go out there to the world and you had a magic wand and you could improve 3 things about the average dentist composite protocol, right? Or another way of asking this question is to ask you what were the three biggest revelations that you had on your composite journey that allowed you to deliver more value and then therefore become remunerated to a higher standard. What would you say those lessons are?
I think there was a phase where I was looking at composite and learning from very, very smart people. And you know, you're trying to piecemeal a solution. So you've learned from this guy, and then he does it this way. You learn from this guy, and
Yes.
you're trying to mishmash this stuff together. But actually, sometimes it's not about going wide; it's about going deep. So if I actually just focused on, for example, you know, I mentioned Sabir a lot because this guy really influenced my dentistry big time. But Sabir Banerjee stuff, I should have probably just drilled down on how he works and adopted those methods and just really focused on that one particular way of doing it, as opposed to hopscotching around from this strategy to that strategy and I'm never really getting the benefits of compounded effort. So I would have said that actually taking a framework that makes sense to you, right, and then drill down on that instead of trying to piecemeal these solutions together, right? Because they're usually you're probably not smarter than those guys. That they are where they are for a reason. And you know, Charlie Munger says it right. He says, you know, don't be so. I mean, I'm butchering it, right? But he says something along the lines of, "Don't be so vain, you know, to always want an original thought." Yeah, it's probably not.
Ah, that's cool.
Yeah, really cool, right? So, you know, stand on the shoulders of giants. So I'm saying I would have stood on their shoulders and said, you know what, I'm just gonna go deep into everything you did. And to be fair, I did like a lot of his courses, but taking it a step further, maybe I would have done postgraduate studies with him because, like I said, he resonated with me. So that's a huge one. Then I'd say the second one is, of course, a big contentious one now, rubber dam. Yeah. Rubber dam for adhesive dentistry is going to help you. Most of the time, it's going to help you. Yeah. There are times where it gets in the way. Yeah. There are times where it's not always your friend, but most of the time, it's going to help. Now, the thing that changed it for me was rubber dam's pretty technical. You know, it's skillful, doesn't always work super well, la la la. But what you can do, right? What I do now is use a split dam and then use a Greta curve, right? Because the Greta curve gives us primary isolation at the matrix level, right? So if people who don't know what the hell I'm talking about, Greta curve is a matrix system from America that I teach. But yeah, so it's a cool system, but ultimately isolates at the matrix level. So you can use that in tandem with split dam, control humidity, get good retraction, don't drop, you know, no worries about dropping anything, and then use Greta curve with it. So that was like a really flexible way where I'd only be shown one way of doing rubber dam. So that really was a bit of a game changer for me. I'm trying to think of a third one now for you.
Yeah, you know what? It's kind of hard sometimes when someone says three or four or five, because then you feel like you have to come out with three. We can call it at two. If those were the two biggest revelations, we're good.
Yeah, let's stay with the heavy hitters and we can tease out some more later.
Maybe some will spring to mind. What is Dre, by the way? What is greater curve technique? What is that?
So in a nutshell, Greta curve is a matrix system. It's the world's first and only universal system, meaning that with this one system with three band designs, you can restore any class restoration, class 2, 3, 4, 5, veneer, onlay, direct composite crown. You do DME with it. So it can solve any restorative direct problem, right? And so they've been around since 2006. They got tens of thousands of users in America, but it's just lesser known in the UK, right? So I stumbled upon it. I'm not going to go through the whole origin story. I've said it a few times on podcast now, but I stumbled across it after doing lots of education and being taught sectionals. And you know what? Maybe sectionals isn't for everybody. Like we get a lot of delegates who say, I just don't get on with them. And that's perfectly fine. It doesn't make you bad, right? It doesn't make you something wrong with you. It just isn't for you. So I was one of those people that it just didn't really resonate. 2018, found it, started using it for a couple of years. And in 2020, heard the inventor, Dr. Brown, very experienced dentist, you know, been practicing 40 years. And he developed it in response to moving from amalgam to composite. So this guy had really seen the shift in dentistry and how it was done. And he came up with this, and he came up with it in 1996 and developed it over 10 years with his pals around America, you know, in impromptu clinical trials, so to speak. Developed a whole framework around it, you know, like can do anything, you name it, like full mouth rehab with it, you know, composite veneers with it, subgingival class 5s, you know, black triangle diastema, you know, you name it, this thing does it. This guy, interesting thing about him, quickly, just to pay him ultimate respects here as well. Interesting fact about Denny, he was a Vietnam War veteran before he studied dentistry. So that was quite interesting, right? So very versatile mind, I'd say. Yeah, very down to earth guy. But in the same vein, me and the delegates, we call Greta Curve the Swiss Army knife of dentistry. You know, like if you was going to have this one thing that packed a punch, you could use it anywhere, even if there wasn't a dental chair. If you only had amalgam, it would work. If you only had GIC, it would work. If you only had composite, it would work. You know, it's just the bad boy like that. But I'm not saying, you know, there's anything wrong with Garrison or Bioclear. They all work. They're all great systems. It makes a bunch of sense. But some people, they don't really want to stock a whole surgery with 30 different parts and different wedges and all the rest of it. So that's basically Great Curve in a nutshell. Yeah, it's very interesting. And then in at the end of 2021, I'd really moved away from associate in and set up this referral service where I'd go into people's practices and do their restorative referrals in-house, and then leave, meaning that I could really cut down my clinical time down to sort of like 10 hours a week. And because of the efficiencies that I had learned from Dr. Brown and some techniques I had developed myself using it, because I've used it for 5 years, you learn a thing or two. And remember, talking about compounding effort, I've just been using this for that period of time and just moved more and more into it, just got deeper and deeper down the rabbit hole. So you learn a thing or two. If there's a problem a delegate raises, I'm like, no, you just do this. There's nothing I haven't seen before that I haven't raised to Denny or figured out through trial and error. And so, yeah, got really efficient on that front, allowing me to reduce my times. And then I said to Denny in 21 that, yeah, I'd love to teach it, and came back to him with an MVP, Direct Restorative Excellence. And that's the official program for Greater Curve. So, yeah, hopefully that wasn't too long.
Very cool, my man. Very cool. So here's the thing, right? Whenever it comes to increasing or enhancing our income, there's basically two components to it. And this is what I always explain to people. Component number one is the level of remuneration we ask for in return for the value that we give, right? The more value you give, the more right that you have to ask for a greater level of remuneration. You're not going to have a Fiat Punto and a Lamborghini at the same price, right? That makes no damn sense. Right, so you want your dentistry to be the Lamborghini, of course, right? And then of course that's reflected in the level of value, and then therefore the level of remuneration. The second way is clinical efficiency. Yeah, it's so that you can deliver more value per unit of time. Obviously, the more value that we deliver per unit time, then what it means is the greater our level of remuneration per unit time, of course. So always, if you have a dentist who wants to enhance their income, it's those two components. It's only those two things, which is really cool. And I love frameworks like that because they let me make decisions, right? And I'm like, okay, well, if I am here and I want to get to here, and I know that there's only two paths, right? Until someone tells me that those two paths are, I don't even know how to proceed, right? But when I know that it's either this or this, I'm like, okay, decision made. I have to pick one of these two or a combination. And I just think stuff like that is really cool. I love my frameworks. Sonny, you've been super kind with time today. Thank you so much for coming along on the Dentistry Invest podcast. If anybody wants to reach out to you off the back of what you said today, where can they find you?
So the website's www.drecomposite.com, and you can find us on Instagram, Facebook at DRE as well. Yeah, that's probably the best way. The email and the phone numbers there, so you can get in touch.
My man. Thank you so much for your time today, buddy. We'll catch up really soon.
Nice one, man. It was too short, James. Too short.
We'll do a longer one next time. Shout out for a longer one. Shout out who wants to see Sonny for a little more time. We'll sort that out. Much love, team. We'll speak soon.